Okay, well, I'm going to go ahead and get started with just some of our housekeeping slides. Welcome to today's Time to Act Mental Health Echo. We're really excited about today's session. And again, if you've not taken a minute, please put your name and contact information into the chat. As you can see, we are recording today's session. We store those on our Canvas page as well as our YouTube channel. We use those for educational and quality improvement. You can always go back and watch those sessions, share those sessions out with coworkers that weren't able to join today. ECHO is an interactive community, so please ask any questions. You can put those into chat, you can raise your hand. Kurt Phillips helps monitor those chats for us, and so he will go ahead and answer them, ask them, not answer them. Maybe he'll answer them, maybe he's smart today, that he can ask those, ask them, why can't I, now I'm all like, oh,
do you want to take over for me? Do you want me to take over for you, Janelle?
Yeah, please do. So, but please be interactive. It's always helpful to have those go on. We always have a case narrative or a case discussion, case problem, whatever you want to call it. It's a great way to learn from everybody on this call, to be able to help and about clients that we are working with. So please stay on for that. And if you have a case that you want some help with, please consider sending us in a case presentation. We do talk about individuals, and so sometimes the conversations that we have are sensitive topics. So please make sure that you de-identify all of the information. If you have questions about what you need to de-identify, please reach out to one of our amazing hub members. They all have the backgrounds behind us or an asterisk in front of their name. Key components of an ECHO session are that we always have a didactic speaker, and then we have that case presentation, and we're also trying to build up those professional networking. So we know who to reach out to when we have a question about something. Just because I've picked on Kurt now, he really does have a lot of useful information, and so maybe I want to know something about what he shared. I can reach out to him. I can message him on here, or I can also find out his email and ask him further questions about the amazing thing he shared during our call today. If you'll take a minute and rename your profile, again, it just helps us know, all of us, who is on the call to build that professional networking. So if you'll take a minute to change that. Again, here's how to raise your hand, but again, you can just put your questions into chat and we will get those answered for you. Pre-registering for the sessions or getting our weekly announcements, you can do that by emailing timetoact@aggies.usu.edu. We send out a credit for attendance. Throughout today's session, we will be dropping a survey link in there. When you complete that survey link, it is when we will send out that certificate of attendance. And thank you always for filling those out. It helps us maintain these free of charge. We are able to take back that information to our funders to say, these are the amount of people that we are reaching, and here's the impact that these sessions are having. So thank you for always filling those out. Canvas is where we store everything. So if you have not received a Canvas invite, you can email us and we will get you set up on our Canvas page. Again, case studies are a great way. There's so many just amazing people on this call that have tons of recommendations. They've been doing this for a while. So it's a great way to get valuable information. If you're interested, just reach out to us. And the case presentation does not have to match the topic that is being discussed. It's really a way to gather information from all these amazing colleagues that are on the call with us today. I don't know why I flipped through that. We have our registration open for our August 2024-25 series. We will be moving to a new platform called our iEcho. So you can scan this QR code. It will take you to that new iEcho. We'll also be sharing some of those things out. We have an amazing lineup for next year around mental health as well. So be sure to join us for that series. And with that, I'm going to stop sharing and turn it over to David Fawcett, who's going to be sharing with us today.
There, the button moved when I pushed the share screen. And, you know, it's always one of those little challenges. Get everything where it needs to be. Okay, thank you. Appreciate that. I'll just do a really quick introduction of myself. I'm David Fawcett. I am the director of the Comprehensive Clinic at Brigham Young University, and we are a community mental health clinic that provides all types of mental health services to the local community, and we do teletherapy as well. Our therapists are all students in graduate programs in either marriage and family therapy, clinical psychology, or social work. And if you are aware of people in the Utah County area or who could use some virtual services, please send them our way. We're low cost sessions on a sliding scale. We run between $0 to $20 max, and we also do psychological assessments for kids and adults. So that's a little bit about what I do. My background and training is I did a master's and PhD in marriage and family therapy. And before that, I did a bachelor's in psychology and a master's in cognitive psychology and neuroscience. I was going to be an engineer at first. And then after completing all the difficult math and physics classes, I switched over to try out other majors because I was trying to find the right fit. Found something called human factors engineering that I was pursuing. I'm actually going to talk briefly about that in just a minute, but anyway, and then moved into marriage and family therapy because I was chasing my wife and trying to be as cool as she is. And that's what she does. So that's a little bit about me. Please feel free to ask questions as we go. I will try to keep an eye on the chat, and then also if I know someone else is monitoring, you're welcome to interrupt as well. So mental health in the workplace. One thing, I guess, just in terms of experiences, I have been in the workplace for 35 years. I've had some type of employment for the past 35 years. So I'm ready to retire, though my bank account says I can't yet. Goals for this presentation. Basically just to kind of cover some of the prevalence of mental health issues in the workplace, recognizing signs, discuss ways that we can support colleagues, and that we can also, you know, be a support to ourselves. Maybe some of this may be things that we need to recognize for ourselves, and hopefully that we can recognize for others, ways that we can prevent and hopefully not intervene directly like in a treatment way, but intervene in a way to help them, to help whoever is struggling get some assistance. Let's see. Now, to truly understand the cause and effect of mental health services, I think what we would need to do is a research design, right? A true experimental design where you have one group that doesn't work at all and you try their mental health, and then you have another group that has to go to the workplace and then you kind of measure their mental health. And I would like to volunteer to be in that group that doesn't have to work, and let's just see how it goes. Or maybe even the AB design, where you kind of like, you work for a little while and then you don't work for a little while and kind of go back and forth. I think that way we could really study the effects of workplace on mental health. But barring that, what we can do is help create supportive environments that are conducive to how people, are healthy and way to be. So I mentioned briefly that I was going to do human factors engineering. And when I say that, most people haven't heard of it, which is fine. A lot of people have heard of ergonomics, which is the study of how we physically can be in certain positions that are more natural, more comfortable, and are less prone to injury, right? So you've seen the ergonomic keyboards, or like you have a standing desk or something so that our necks aren't cranked looking down at a laptop all day. So that's what ergonomics is. Human factors engineering is taking that idea of making a workplace fit a person physically and changing it to the way people think cognitively. So creating a user interface that's more intuitive, using colors, using spacing, using grouping, so that the cognitive load is reduced, thus reducing human error, increasing productivity, making it just general having a better overall effect. Now, what I have not studied, and I'm not sure if it's a very big thing, is there a study in making the workplace emotionally conducive to how we are, right? I know there's physical, I know there's cognitive, but are there ways to kind of fit the emotional things? And I think that's an interesting thing. Like there's OSHA is an organization that protects people by having safety features physically in place. But we don't have a similar thing for the emotional side or protecting the mental health. And I'm not trying to advocate for that, but I just think it's interesting. And it definitely has an impact on productivity, on quality of life, on economy. So overall, in terms of cost and prevalence, so the World Health Organization estimates about $1 trillion per year in lost productivity due to mental health issues, right? Now, that's an estimate, that's worldwide. I don't know how they determine, productivity versus not, but it's a pretty significant amount. I don't think measuring people's mental health in terms of dollars is very effective. I think there are better ways to do it, but that's something that I think is really easy to understand, and it's a big number. $1 trillion sounds like a lot of money. So it's a way to get people's attention. Also, there's numbers that like 1 in 5 adults experience a mental health issue each year. And this isn't just a minor episode, it's like a significant diagnosable issue. And there's acute versus chronic, reported versus treated, hidden versus obvious. And so there's so many factors, it's hard to know exactly what the landscape looks like. But we're going to try to cover what we can. Certain fields, such as healthcare and technology, tend to have higher levels of stress and thus burnout. And there may be various reasons for this, such as, the healthcare field, for example, it can be really high stakes, right? There's a lot of pressure to be right, to help people in literally life and death situations, sometimes life-changing things. And you couple that with some corporate pressure to get people through, right? There's the stakeholders who are kind of putting pressure on to be high performers in terms of making a profit. And so there are these competing things of wanting to provide excellent service and also wanting to provide quick service. And, those don't often go hand in hand. So I've got a few friends who are medical doctors, and some of them have talked about how frustrating it is that they want to spend more time with patients and the system just stacks them up and pushes them through, which then leads to higher stress. And I actually know some doctors who said, yeah, they were able to put boundaries in place. One who is a surgeon, and I was talking with him about this specific topic, and he said, I have said, I will only do this many operations. I don't, bring in other people to close or whatever. Like he said, I need the time to do a good job because that's, my standard, my quality of work. And he's like, I've had a lot of pressure from people, but I do a good job with what I do, and I've held that boundary. Now, he probably could be more financially benefited by running more through, but he has chosen to make a boundary. And that's something we're going to come back to later in the presentation. But that idea of his mental health, his own like decision to do a higher quality job and have less output overall is something that helps him prevent burnout and reduce that stress. So outside of the scope of this presentation, but still important and relevant, is this idea of flow. If you're familiar with, I think it's Michael Csikszentmihalyi is his name, researcher, and then Martin Seligman, they did some research and studies in this idea of flow just in our daily lives. And it's capturing that place in your life where your ability matches the challenge of the job or the task or whatever it is. And when you get those at a nice, a nice point where the curves meet, then people experience flow. And that is satisfaction. That is enjoyment. It is a fulfilling experience to be in a place where you can do a task. It's not mindless. There's enough challenge to keep you engaged and entertained, not just entertained, but like, just going with it, but that it's not overwhelming you and causing the burnout. So that's an important thing to think about. Again, that's a whole nother presentation on that. I just wanted to kind of mention the topic. So certain groups are more likely to report mental health issues. This doesn't mean they're more likely to experience them, though it's possible that that's the case. But younger employees and women are two groups that have been identified as being more likely to report mental health issues. Some of the reasons for this could be that the upcoming generations, there's less stigma and they're not having the same kind of social pressures against seeking mental health services. I think sometimes, I don't think sometimes, women are exposed to more life stressors, especially mothers. Mothers who also work tend to have a larger proportion of the home responsibilities compared to fathers who also work. And when both work, the mother still has more kind of home responsibilities and childcare responsibilities, which then will add to overall stress and well-being issues and things like that. So there are a lot of potential factors, but it's just good to know that these are groups that are more likely to report, because they may be some that are more important to pay attention to in our workplaces. This was just an interesting thing I came across, scrolling memes, sometimes just to numb life for a couple minutes, scroll through some memes and look at things. And it was interesting to me, the way this is worded, I was just like, oh, okay, 25% of adults say their workplace promotes a supportive environment for mental health. And then like, it occurred to me, like, that means 75% of adults say that they don't promote mental health. And that one just kind of hit me harder, in terms of there's a lot of us out there who are feeling like we're not well supported in terms of we've got a workplace that cares about who I am, how I'm doing, and they may be more concerned with what I'm doing and how much output I have. So interesting things. What are kind of the common mental health issues that parallel like things in the workplace? Anxiety is probably a big one. It's not probably, it's like 20% of the population struggles with anxiety annually. That doesn't mean that 20% always has it. It probably fluctuates back and forth, but that's an estimate again. And those statistics also fluctuate by gender. So it tends to be higher again for women than for men. About 14.5% of men report. They could be underreporting. That's probably really likely. And then 23.5% of females report, you know, the struggling with anxiety issues throughout the year. And these symptoms, a lot of us are familiar with symptoms of anxiety, but excessive worry, restlessness, difficulty concentrating. For those of you who are in my age cohort, you may or may not like The Simpsons, but it's a significant pop culture reference. It came out when I was young, and it's still going on. But you know, those of us who enjoyed it back in the day will say, well, those were the glory days, those were the best episodes. Anyway, there's one episode where Homer starts making some inventions. He starts creating things. And one of his inventions was an alarm that sounds every 3 seconds as long as everything is okay. As long as everything's going okay, this alarm will sound every 3 seconds. And I kind of have used that as an analogy for that's what anxiety can feel like. It's like every 3 seconds there's an alarm going off, kind of for no reason. Another common one that we see in the workplace and that is linked to workplace activities is depression. Major depressive disorder can affect about 7 to 10% of adults, which seems like a small number, except, and this is just in the US, probably worldwide too, but if you consider just numbers for the United States, that's about 21 million people who are struggling with major depressive disorder. And then we'll have acute episodes versus higher, you know, things, and it can be a big barrier for those people in terms of their performance in life, not just at work, but just in life in general, with their families, with their relationships and social settings. And some of that can be directly tied to conditions in the workplace. Stress-related disorders, there's no surprise that this one is directly related to workplace. A lot of people, you know, just kind of spend the year looking forward to their vacation so they can relax, because the rest of the time they can't relax. There's always something that needs to be done, something doing. And then what we find is a lot of us get so excited about the buildup for the vacation that the most enjoyment we get is like the 3 days right before the vacation, looking forward to it. And then we spend a lot of the vacation worrying about having to go back to work. I'm not saying to everybody, but like that's a big thing too. And so when we are in a situation where we can't even enjoy a vacation because of the stress we have to go back to, again, this work-life balance, and it's things in the workplace that that could be improved to help our overall just general well-being. I had a previous employment and it was a decent job. I enjoyed the people I worked with. I enjoyed the clients I worked with. But one thing that was really difficult was taking a day or two off in the week always caused me some anxiety, because it didn't mean I just didn't have to work. It meant I had to fit 5 days of work into 3 days of work and do all of that. And then those hours that I otherwise wouldn't have been working, I don't have to work. And then it usually took, it took me 2 days to do extra work to get ready to take a day off, and then 2 days to catch up. And it was just like, this isn't fun. This isn't like, I don't get to relax on this vacation or get away or use something there because I'm so, anxious thinking about work. And I don't even consider myself a very anxious person. But in retrospect, and sometimes looking back, I'm like, oh no, that was affecting my quality of life. And I think it actually led to burnout in that particular job. That was one that by the end of that job, I was ready to be done. And I think that was part of the thing. Some of the things to look out for, and this may be your own, like paying attention to yourself, but things like social disruptions, anhedonia, or the lack of interest in things that used to be interesting, sleep disturbances, avoidance, things like that can be signs of those extra stressors. And another thing to kind of pay attention to is they can kind of slowly build up, right? It's kind of like that analogy of you put the frogs in the water and then you slowly turn up the heat and they're less likely to jump out. But if you put them in really warm water, they jump out real quick, and it can kind of build up on you that way too. So what is some of the impact of poor mental health on work? Well, obviously one that we hear about a lot is productivity loss. And this is one of those things that I don't know, there's a part of me that's like, yeah, sometimes we're not as productive, right? We're always told like always give 100%, but we can't always give 100%. But if we did give 100%, maybe it would look like this, right? I always give 100% at work. And on Fridays, it's only a small proportion of that 100%. But another analogy, I'm a runner. I'm not a great runner, but I am a runner. And I can run 100% capacity for about 50 to 100 yards right now. Now, I'm not saying my 100% is what my 100% used to be. And I used to be able to give 100% for a lot longer than 100 yards, but that's what I can do. Like, that's my 100%. And then I have to stop and like sit down and, catch my breath and get back down going. I can run at 70 to 80% for like 3 to 5 miles. Like, I can keep that effort for that distance. And I can probably run 50 to 60% for 10 to 15 miles pretty easily. I hurt after, but like if I'm giving 100% metaphorically, I can't sustain that for 8 hours a day. And I think there needs to be that expectation of when you're in a work environment, both for yourself and your employer, needs to understand that you don't always run on the red line. I'm going to switch metaphors here, right? On the engines, you don't run on that red line all the time because that blows up motors and it blows up people. So we need to think about productivity in terms of reasonable expectation performance for the task and the long term. There's sometimes where you've got a deadline coming up and sure, you turn that performance up for that time. And then maybe you take a little bit longer break afterwards. So some things to think about. Some of the other effects of poor mental health includes absenteeism and presenteeism, which is a fun word. Absenteeism, I think, is pretty obvious. It's people don't show up. They're not there. They tend to miss more work. They take more days off, usually in the form of sick days. But presenteeism is where people are still showing up because they have to, but either their productivity is down or they're just not paying as much attention. They are unproductive. They're looking for other things to distract them. And, one analogy of going back to the sports metaphor, the running metaphor, is this may be like an injury, right? Like you push too hard and you end up with a pulled Achilles or a strained muscle or something, and you're not able to train or work or race or whatever other sport you like to do. You can't do the performance at the same level because you've injured yourself. And even if you show up to practices, you might not be able to put in the same effort that you would have if it hadn't been pushed so far, or if you don't get the treatment that you need, once there is an injury. And, I kind of like that metaphor because I think it's something that we can understand. It's something that related to the physical world. It's so difficult to see people's emotional states unless we see the physical symptoms of them. But using a metaphor like that, I think if we as employers, as managers, or as employees can help others understand that idea of when someone's experiencing mental health, let's maybe treat it like a little bit of an injury that needs some healing, that needs some time to recover so that they can then, be present in their job, even if they're not going 100% all the time. Another symptom, high turnover rates. So when there's poor mental health and excessive stress, then we get people, not staying very long at jobs, coming and going, switching jobs frequently, trying to find that kind of sweet spot or trying to recapture the excitement of starting again, or trying to escape a toxic situation. And so there's a lot of turnover, which has a high cost in terms of for the employer, but it also can be demoralizing for other coworkers. So, and it's hard to get through the training. I know with my current job, it took me about a year to finally feel like, okay, I think I have an idea of what I'm doing. You know, and if you're always getting people turned over, then you may never get too many people who feel like they know exactly what they're doing. What are some of the signs of mental health? I mentioned this just a second ago, but it can be hard to see the emotional response unless there's some sort of physical symptom that the person is allowing to show. But some of them to kind of pay attention to are changes in work performance. And I would include like note changes in patterns, right? Overall, it may not be like one day to the next, but looking at the bigger picture patterns. There's a little vignette I'll kind of talk about here in just a minute. But just those changes in how things go, they may be acute and they may be chronic and it may change over time. But it's just, sometimes it doesn't mean that there's something big going on, but sometimes it does. And sometimes, again, it's like that turning the heat up. It's these things can slowly build so that you don't notice them. It's not as obvious to you, either as the employee or the employer. And so just kind of being in tune with them can be helpful. Anyway, withdrawal from social situations, increased absenteeism. There can also be the physical and emotional signs, such as just someone looks fatigued or exhausted, or they are fatigued and exhausted. My employees where I work are undergraduate students, and they're already exhausted, right? Like they've got so much going on with their course schedules, and they're trying to have a social life, and they're working, and so they're exhausted. And I've literally walked in on some of my employees, and they were like conked out at their desk. And, you know, there's a part of me that's like, hey, what are you doing? And they're, yeah, but there's another part of me that kind of wants to go, oh, you must be just beat. Are you okay? Like, things all right? What can I do to help support you? You know, and having those discussions. Mood swings and irritability, difficulty concentrating, things like that. Again, these don't always mean that there's a mental health issue, and they are signs. And when you get multiple data points coming in and patterns of change over time, then, you know, it's time to pay attention. So here's a quick little kind of, not a case study, but maybe a vignette. So Tom works middle management. He's a real positive, good-natured guy and regularly interacts with the employees, other employees, his peers, and also those who he manages. He talks with them in socially appropriate ways. Hey, how's it going? When you ask Tom, how's it going? He's like, great, things are good. He regularly shows up on time. He's participating in meetings. You know, when you send him an email, he gets back to you in a timely manner, right? We've all been Tom. We've all seen Tom. And let's say that Tom works in your place for 3 years, and this is kind of the overall pattern. And then one day you kind of notice, hey, Tom isn't like talking to the employees as much, right? He's kind of slowed down. He kind of does the half smile, like you know, our half smiles as we walk by. Instead of sitting down for a brief chat, kind of like a smile away, still sociable and friendly. You know, instead of like, how's work? Oh, it's great. Love the job. It's like, it's a job, you know, living the dream. Little things like that. It shows up close to on time, not so much that you're like, oh, you know, he's 3 hours late again. It's like, you know, 15, 20, 30 minutes late. That becomes more of a pattern. The meetings are still in attendance, but the participation goes down. The email thing starts to lag. These could be signs that Tom is starting to experience some work-related mental health issues. Again, this isn't like conclusive diagnostic, but there may be a pattern of change here for Tom, right? And this is something that we can pay attention to in ourselves and those around us. So how do we help? Obviously, you know, we create a supportive environment, whatever that means. What does it mean to say, oh, well, my environment is supportive? I think what it means is there's open communication, that people can feel comfortable and confident talking to you, that you create a place where it's not going to feel punishing. It's not going to feel like they're being degraded. but that they're, getting help. This isn't to pat myself on the back. This is just an example of a communication I had with an employee that I think could have gone poorly. He got to the point where he was consistently late, like late to especially his morning shifts when he was opening his office, and we needed his office open so that other people could get the materials and resources they needed to start at 8 o'clock. So he needed to be there at 7:45 so that other people could start at 8. And he was being more and more consistently late. And some days there weren't people at 8 o'clock who needed stuff, but other days there were. And so, instead of doing a performance review where I came in and kind of did the hard line of, hey, this needs to change, and we've got to have this done right, and you need to show up on time, otherwise I'm gonna have to let you go. I started off with, what are you struggling with right now? I hope you're okay, and I'm wondering what you're struggling with. And he talked about how mornings are really difficult for him, that he intentionally doesn't take classes in the morning because mornings are hard. It's hard for him to wake up that early. And because he doesn't take classes in the morning, the area lead was assigning him the morning shifts because he didn't have classes. And so we were able to kind of talk about, okay, that helps me understand what's going on. You still need to be here on time, but what we're going to do is change your work schedule so that you don't have to work as many mornings. It's not fair just to have everyone else work mornings and not you, but we were able to change his shift. And then, the tardiness reduced significantly. I'm not saying he was perfect after that, but it went to a place of, I was hoping anyway, to communicate that I'm here for you, I want to support you. And it was that open communication. And he and I have a great ongoing working relationship in that he comes to me with issues, he offers help for things, and he asks for, what can I do to help when there's downtime? And I think that would have been different if I'd kind of gone with my kind of reflex issue of kind of putting down this hard line. And so again, I'm not trying to pat myself on the back. I'm not saying I've done it perfect every time, but I think that was one time, like, creating a supportive environment looked like asking how they were doing in terms of looking at the symptoms of the issue rather than the issue. All right. Promoting a culture of well-being. Oh, no, sorry, I'm looking at the wrong one. I'm looking at the next slide. Connecting to resources. So just helping people know what resources are available. If your company has an EAP, or if there's counseling services from the insurance that you provide, maybe even just having a list of those providers and saying, hey, these are all on our insurance. You don't even have to go and look them up. They're available. If you need them, they're on the wall. You can scan this QR code to get the list online. It's just available. Workplaces that encourage mental health days, like that they allow people to take a sick day when they're just feeling overwhelmed and stressed out. Like they are still using their benefit, there's a benefit, but they don't have to be physically ill and get a doctor's note. But allowing things like that can improve the overall culture of mental health in a workplace. We talked a little bit about the check-ins and stuff, but getting feedback and then following up with employees about how you've applied that feedback, how you made it work. Having peer support programs, and then just encouraging a work-life balance. I like to talk to some of my employees about, hey, what are some of the things you did this weekend? What are the things that you enjoy doing? I don't know. It's not that I'm letting them snowboard on the job, but like talking about snowboarding, helping them understand that what they do is important, not just the work that they do. Little things might make a little difference. I think another important thing is to advocate for yourself. There may be times when we as employees need to go and say, hey, I'm struggling. I'm struggling with this amount of work right now. And it's not because I'm not a good employee, it's because it's more than I can do. And so I'm going to need a little bit of time. And that's a hard conversation to have with some bosses, right? It may be an impossible conversation to have with certain bosses, but where we are able to advocate for ourselves, that can be important. And when an employee of ours comes to advocate for themselves, finding a way to have that conversation and be supportive, even just feeling supportive, even if we can't like, completely change their workload, but doing some small things can go a long way to feeling like they're heard, that they're supported, and all that. One of the long-term kind of symptoms, outcomes, problems is burnout. They get to the point where it's not just lower productivity, they get to the point of, I just don't care anymore. I'm going through the motions, but like my motivation is gone. I don't feel like I'm valued. I don't feel like what I do is, that worthwhile. They need me to do it, but like, it's just like, what's the point? And that's a hard place. That's, I think, where it gets, the risk of them changing jobs or leaving goes up, but it's a hard place for someone to be emotionally. It affects the rest of their life. And so what we really want to do is help avoid the burnout, get them to a place where they're not feeling that exhaustion, they're not so cynical, and catch them during that progression of mild stress and help them rebound before it gets to the complete burnout. So prevention and reduction, some of this is prioritizing. Sometimes it's like, hey, I'm not going to be able to get to all this today. I'm going to make myself a list. This is what I can reasonably accomplish. I'm going to do that, and I'm going to feel happy about it. Instead of I'm going to shame myself or give myself a hard time for not getting through everything that I was supposed to do. But I was able to get through, a task or two tasks. Things like mindfulness, reducing on-job stressors where possible. Sometimes it may be like, I've had coworkers who liked to chat. And I don't mind chatting with coworkers, but there were some times that their chatting turned into like, this was an hour and a half of stuff that I needed to get done. And maybe having a brief conversation where you set an appropriate boundary with them. It's like, oh, thank you so much for taking the time to chat with me. I really appreciate it. I need to go get a couple things done, but I'm really glad that you caught me up on those things. And, still being polite, but setting those healthy boundaries. And that's just one example. There are lots of other places to reduce on-job stressors, but encouraging physical health, exercise, and nutrition. Now, this is one that is said a lot. And I find for me that when I take this part seriously, I'm happier at work. For example, several years ago, about 7 years ago, when I started at BYU, I decided that on my lunch break, I was going to exercise. I was going to do a little run. And I did that for a year and loved it. And then life got really stressful. I needed to start picking my kid up from kindergarten during my lunch break and taking him to a more different kindergarten. And so I lost my run time. And after the end of that year, I did notice that, kind of my overall life satisfaction had dipped. It was down. So when I take that time to be intentional and do those things to take care of myself physically, I'm happier overall. And so then what I'm saying is, as employees and employers, if we can find ways to balance that somewhere in our life, and help others prioritize it, it can be a very useful thing. Another aspect of this is just having reasonable workloads and expectations, right? And I think this pie chart in the top right corner is a good example. Reasonable workloads may not mean that everyone's piece of the pie is the same size in terms of this is what I'm going to carry. Some people are going to carry certain things easier than others because they have more training, they have more experience, or they're just, they're able to run at 80% instead of 50%. That's okay. It doesn't mean that everything that, they always have to get the 80%, but just having a reasonable expectation and even being able to let someone know, hey, this is a bit too heavy right now. Can I have a smaller piece this time? Things like that. Flexible work arrangements, right? Like we all learned during the pandemic that we're all going to still talk about for the next 50 years, but that we can have flexibility. There can be some variability in terms of how things can operate. And sometimes it's allowing an employee some flexibility in terms of, yeah, you can do that work virtually. sometimes it's just not possible, right? I can't have my people who run the materials room in my office work virtually because they have to be there in the materials room to do that. But there have been extra tasks that needed to be done online where someone's like, hey, you asked me to do this task on the computer. All I need is an internet connection. Would it be possible for me to work on this during these hours, but not here? And we were able to work some arrangements around that. So when possible, having some flexibility can really help quality of life and work-life balance and all that. Just a real quick recap. It's a prevalent problem. There are signs that we can watch for. Look for trends, look for patterns. Try to intervene before it gets to the point of intervention, right? Or having an early preventative or early intervention is easier than a full recovery. And then here are just some websites that have some great information. I also started to collect a bunch of local resources for mental health across from Cache County all the way down to Utah County. And the list got so long, I thought this is not going to be helpful. It's just going to be information overload. But it's pretty easy to find. It's easy to find resources. It can be tricky to find the right resource for each person. But, I guess I would just say have some perseverance and we can get it. So that is that. Are there questions? Oh, whoops, I want to do this.
That was such a wonderful presentation. I really enjoyed it. If anybody has any questions, you can go ahead and just put it into the chat or just come off mute and ask your question.
Appreciated how you stressed the subtlety, how this can happen in a subtle way. That person could be powering away, and changes come like we had with the pandemic, and then a returning and some excitement in returning, and then you take a look at it, and many people may be struggling, or one person may be struggling, but how it can sometimes it's not apparent right away, and it's hard then to get in time, and then it kind of can snowball to a bigger thing. So I appreciated how you emphasized that watching for it, and then having that environment that welcomes talking about it, and that can be really hard. I think people being afraid they'll get fired, or needing their job, and maybe to a point of it's more flexible than they realize because they're so caught in their anxiety.
Yeah. Oh, thank you. I appreciate that feedback, and also just kind of that re-emphasis of it can be hard to have those conversations, right? Especially when you're going up to talk to your boss, because what's more stressful, having a job where you have stressful things, or all of a sudden losing your job because you went to talk to your boss about being stressed out? And now life just got a whole lot worse.
Right. Well, David, I certainly appreciate your time and that great presentation with everything. So for our breakout groups today, we are going to just talk amongst each other kind of around this same topic, not necessarily a case, but based on what we've learned about what types of mental health does your program experience, what resources are available for employees, and then how does your company or program support employees that are experiencing mental health concerns? So I'm going to go ahead and put us into breakout groups. If you'll take a minute, have members to do introductions and assign notes. Hopefully we'll get some great resources that we can all utilize to support our mental health at work.
And in mental health and in how to handle mental health situations. But I do have resources that I've gathered over the years, and this echoes a great way to gather resources. So you find out information here, figure out what the resources are, and then point people in the direction of the resources rather than faking it and trying to have someone like me trying to give the information or techniques or solutions to the people's problems. So I think that's a key that we came up with, is making sure we've got a good handle on what those resources are, regardless of what our profession is.
Great. So Rebecca, how about in your guys' group? How did you guys talk about how their companies support employees that are experiencing mental health?
Yeah, sure. We saw a lot of, I'm going to say like structural sort of supports, but as well as kind of just like layman's between the coworkers, maybe the supervisors really enacting it. So there's like peer supports, places to like staff cases you have, as well as like actual mental health hours you can take off, things like that. And then there's also just, if it's a sunny day, go out, enjoy the sun for a little bit. The supervisor's like, hey, go do this thing. It'll be good for you. Also having like a wellness break room. It sounds like some people are able to like talk through with other coworkers, as well as like maybe they're having a hard time and you go and grab them a meal or something, help them out in a lot of different ways.
Those are great resources. So we compile those. If whoever in your breakout groups took the notes, if you will email them to myself, we will get those compiled. The resources and recommendations are always on our Canvas page. So if you want to go and figure out what everybody else said, you can always go to those. We are not going to have a session in July, so look for the save the date for our August 2024 sessions network that will start here in just a while. And thank you all for joining. Enjoy the rest of your day.